cannot go to ride the unrideable road, to love pure and chase from afar, to try when your arms are too weary, to reach the unreachable star. This is my quest, to follow that star. Don't matter how hopeless, don't matter how far, to fight for the right without question or pause, to be willing to march in hell for an heavenly cause. And I know if I only be true to this glorious quest, that my heart will lie peaceful and calm when I lay to my rest. And the world will be better for peace, that one man is born and covered with scars, still strove with his last ounce of courage to reach the unreachable
Einstein. 1,000 times a day, I remind myself that my material and spiritual life depend on the fatigue of other men, living and dead, and that I must work to give in equal measure that which I have received and continue to receive. Albert Einstein. In this study, we have some good news and some bad. I'll read you both. The reporter is called Henderson, and he was a medical director during the Second World War. He was an orthopedic surgeon, and he made a clinical comparison using the soldiers between those treated with chiropractic and those who had ordinary medical treatment.
Lui ha preso i suoi risultati e li ha mandati all'Associazione Medico Americano che hanno solo 40 anni dopo.
He sent his results to the American Medical Association, which didn't make them public until 40 years later.
La chiropratica ha risultati impressivi.
His conclusion, chiropractic has impressive results with various medical failures, and chiropractic techniques produced results as fine as the best medical treatment and should be integrated into all Army clinical and orthopedic wards.
Clinica ortopedica dell'esercito.
He also noted that chiropractic had significant success with women in the final 3 months of pregnancy who were able to conclude their pregnancies and give birth with greater comfort when they received chiropractic treatment. As I said, it took 40 years for these results to appear, and eventually they came out during testimony in the Chicago District Court 40 years later. Our question is why such clear and happy news was hidden for so long. In the United States, where health care costs are always rising, insurance companies work together with organizations of doctors at all levels to give the consumer private insurance and health treatment.
C'è stato fatto nel 1982 un'indagine.
In 1982, a study was made by one of the largest of these organizations in the entire southeast of the United States. 100 patients were sent to the Silverman Chiropractic Center.
Prima degli aggiustamenti chiropractica,
Before chiropractic adjustments, 80 of the 100 patients had been treated medically, seeing on the average 1.6 doctors each without results.
17 avevano diagnosi medico di aver avuto problemi discali.
17 had a medical diagnosis of disc problems, and 12 were diagnosed as in need of urgent surgery to the disc.
Dopo la chiropratica, chirurgia non è stato fatto.
After the chiropractic treatment, 80% of the problems disappeared. No surgery was necessary, and all the disc problems were eliminated. No patients got worse. Now, the interesting thing is this. The medical director of this organization, which is called AviMed, who was responsible for this study, is Herbert Davis. He concluded that chiropractic and chiropractic adjustments had saved his organization $250,000 in surgical expenses.
Herbert Davis.
He said that as he had initially been very skeptical, this study had turned out to be an eye-opening experience for him.
$250,000 in spese chirurgico.
He had never imagined how effective chiropractic could be. That was Herbert Davis, an MD, director of the largest medical organization in the southeast of the United States. Professional formation. How did that tree get so big without medicine?
Nell'ultima puntata stavo parlando della scuola di chiropratica Palmer e continuerò a parlare, e nella puntata prima di quello parlava di un studente di chiropratica che è stata mezza paralizzata in un incidente stradale e poi totalmente guarito.
In the last episode, I talked about the Palmer College of Chiropractic, and I'm going to say some more about that today. And before that, I spoke about the student who was paralyzed in an accident and completely recovered after his spine was put into its original position by a chiropractor. At Palmer, the body is observed in all its aspects, without giving an exaggerated emphasis to illness, because there we realized illness only occurs when we give the body a burden that it can't support. In the colleges of chiropractic, everyone becomes an expert in health, much more than a medical student who becomes an expert in pathology. This is a big advantage in today's world. And don't forget that we studied, with the exception of pharmacology and surgery, all the subjects that were taught in medical school. Frank Sabatino, the editor of the Underground newspaper, student body president and first in his class, helped me to guide my thoughts to the most important considerations. He immediately suggested that I should read Herbert Shelton, who had overseen 60,000 fasts, to make me understand that we as doctors should not be necessary to anyone, except in the case of trauma or birth defects. The body is able to take care of itself, and we are simply compensating for the errors committed by the patients, their doctors, their intoxication, and our unnatural society. Frank taught me to repair the vertebral column, which meant understanding with enormous respect where its correct position is and how this protection of the central nervous system is decreased when it undergoes a subluxation. It also meant learning how to recognize the responsibility of the individual in removing the cause of disease. That means teaching doctors and patients to live in harmony in order to strengthen the organism completely by themselves, even without the doctor of chiropractic. From this starting point, I have become a human bridge leading those who need help to become those who don't need it anymore. And of course, I am an example of self-sufficiency. My first patient, myself.
Oggi parleremo delle allergie, come ho detto la volta scorsa, e questo è un campo in cui...
This episode is meant to answer the criticism I often hear that I seem too sure of myself. Rest assured that when I'm speaking in a professional capacity, this is because I really do know what I'm talking about. And when I don't, I keep quiet. Today, we're going to talk about allergies, a field in which I have a first-hand experience. When I was 5 or 6 years old, I went camping, and one of the games was running in the cornfields. Once not knowing that pesticides had just been sprayed, I came out of the field and my face began to swell. My parents were obviously alarmed, and they took me to the allergist. I ought to tell you that my point of view in this field is not impartial, and there's a reason for this. By the way, I'm going to make a lot of allergists angry, but on the other hand, it will please a lot of patients. Let's look at the situation in this way. I've already mentioned that I was totally intoxicated before my birth. If inside our body poisons circulate due to the fermentation and putrefaction of undigested foods, then the addition of irritating substances, like pesticides, increases the load on the body's defenses, which must keep the poison outside. The first defenses are sight, smell, taste, the skin, intuition, and movement. Then if poisons pass these first 6 defenses, they enter the respiratory and digestive systems, then the blood, and all 3 have their defenses too. If we are reasonably clean, there are good defenses, and the reaction will be limited. If I, on the other hand, was so intoxicated that my swollen tonsils were already filled with poison, then the reaction was, of course, more severe. Where's the lie, then? Well, after 15 years of weekly anti-allergic pharmacological treatment, during which I never received even one piece of dietary advice, the diagnosis was always a genetic problem. I was condemned to suffer from allergies for the rest of my life. The problem is that this simply wasn't and isn't true. If we eat really badly, then the body becomes hypersensitive. If we eat properly, we can avoid all these problems. And that is what I did for the next 23 years, from the time that I was at chiropractic school until now. I want to save you these 23 years. The next episode will deal with the problem of biting my nails. Homework. Number 1, don't eat butter or oil that has been fried or heated. Number 2, fruit should only be eaten on an empty stomach. Number 3, proteins and carbohydrates should always be separated. Number 4, if you do not feel well in any way, don't eat proteins until later. Number 5, don't eat when you are angry, tired, or unhappy. Number 6, don't eat immediately before sleeping. Number 7, drink 4 liters of water per day, per weight approximately 1 liter for every 15 kilos or 30 pounds, on an empty stomach or 3 hours after the main meals, adding between 30 and 100 grams of honey per liter, and if you like, lemon juice. This is not for diabetics. Number 8, keep wrapped ice packs on the abdomen to the right and left of the navel for 6 to 24 hours a day, not if you're pregnant. Ice packs must be so well wrapped that no cold is felt. Number 9, decongesting massage with weights from 1/2 hour to 2 hours a day.
Ritirare gratis le dispense telefonando a Telesicilio Collar 095 32 22 23.
Homework.
Fra una dieta normale, del quale parleremo più tardi, E le etichette che abbiamo parlato la volta scorsa, di quei pochissime sostanze, acqua e miele e frutta che ci danno molto energia.
There is, of course, a difference between a normal diet, which we will talk about soon, and the diet we talked about last time, composed of very few substances: water, honey, and fruit. These give us energy when we are really weak, because any other kind of food would simply get stuck. If that's not clear, just think of those who are in a hospital on an IV and not eating. They don't get sandwiches or spaghetti with garlic and hot pepper because they would immediately block their digestion and suffocate them. When the individual is a little bit stronger, not really well, but able to chew and swallow and digest, assimilate and eliminate. Remember, the food mustn't just go in without problems, but the useless substances have to come out within 24 hours too. We go on to a detoxifying diet: water, honey, and fruit separate from meals, cereals in grains at lunch and dinner, together with vegetables and a salad. This is the detoxifying diet. Again, water and honey, lemon and fruit on an empty stomach for breakfast and for a break. You can cut down or eliminate the honey if you have glycemia problems. At lunch and supper, a diet based on whole grain cereals, rice, barley, wheat, millet, rye, not whole wheat bread or pasta, especially not one of those highly commercialized brands. The sort of bread or pasta products you find in a health food store where the quality of the product is not a problem will be added in the normal diet when the body is already healed. Eat as much as you want, but only when you're hungry and have already finished 4 liters of water first. Now I see clearly. Nella Scalise is a very special person. She has received a national award from the National Business Bureau.
This honor is awarded by the President of the Italian Republic each year on the 1st of May. I received it in Palermo.
Nella came to my office because she was feeling very badly. She was so ill that she was about to quit her job.
Cos'erano? 10 anni da male?
Sì.
Cosa hai detto? Mal di testa?
Mal di testa, mal di schiena.
Mal di collo?
C'era la cervicale e poi...
I suffered from a headache, backache and cervical pain, muscular pains and cramps. Before the therapy, my weight was 67 kilos, 152 pounds. Now I've lost 12 kilos, 24 pounds. I work happily and I'm self-sufficient.
You did your part, I did mine. Now, can you explain why you came here?
I met Paul through a relative of mine, and so I decided to give it a try too.
Project Genesis will help put other people in touch even though they don't have a relative who knows me, and they can help themselves at home.
Il dottor Rodberg ha cominciato a farmi dei massaggi.
Dr. Rodberg began with massage.
Let's be specific. Adjustment of the spinal column, lymphatic drainage.
And with the right diet, I gradually began to lose weight.
Did you lose anything you needed, or was it all unnecessary and toxic?
Oh, no, it was all toxic. Gradually, I recovered the balance I'd lost. Now I am self-sufficient and serene, thanks to Paul.
ho riacquistato il mio equilibrio che avevo perso in un certo qual modo.
Quindi hai raggiunto quella promozione da
Certo,
ex paziente,
certo,
sei autosufficiente, no?
Adesso sono autosufficiente, quindi ripeto, ho ritrovato il mio equilibrio, sono contenta
Possiamo
e
dire alla gente?
ringrazio
Prego,
Paul.
possiamo dire alla gente quanti
Can we tell the listeners how old you are?
uomini?
No? Okay, we won't say.
Quanti anni hai?
Well, Nella has never been on television before, and today she's done pretty well. Don't you think so? Thank you very much.
Molto
See you
meglio,
soon.
certo,
All right.
certo, infatti.
E Nella che non è stata mai in televisione, oggi se l'ha cavata abbastanza bene. Io ti ringrazio. Ci vediamo
Prego.
per la prossima, va bene?
Va bene.
Ok.
Thank you.